The Steps Hip Spica Care DVD is made for parents and carers of children in hip spica cast. They are a series of mini videos which cover aspects of looking after a child in a cast. The videos are examples of how real families coped with everyday tasks of looking after a child in a hip spica. They are not meant to be fully comprehensive and cannot tell you everything you will need to know about hip spica care, but hopefully they will reassure you that solutions can be found to many practical problems. Remember that it is best to contact your healthcare professional if you have a problem you cannot solve. Parents, carers and healthcare professionals have reviewed these videos.
My little girl's 5 and she's had 2 operations now on her hip. The first time was when she was 2, so she was very small, and the second time was when she was 4, so she's quite big for a 4-year-old as well. The additional complication we have is that Sophie has a genetic condition, so she has quite complex special needs. She's got a global development delay, really reduced muscle tone, she can't talk, so she can't communicate with us. So it's a very different scenario to attempt with the 2 operations. It's been quite difficult for us really. But you have resources available. There's lots of people you can discuss who've been through the same procedure before. And also, really, there's a whole network of people out there as occupational therapists, physiotherapists, all sorts of things that you can tap into as well. So really, it shouldn't be a problem with a child with special needs. Yeah. The preparation for going into hospital is a little bit different really. For one thing, Sophie can't talk with us and we can't explain to her what's going to happen. I mean, as it is, she's a very happy-go-lucky girl, and we're able to coax her into most things. As long as you're there by her side, you can reassure her, you can cuddle her and hug her. As long as she feels very comfortable and safe, she'll generally go through quite some difficult situations without really feeling worried about it at all. You can't explain what's going to happen, but the fact is that you're there, you're with her, you can reassure her and make sure that everything's fine, and really she'll go through that very difficult situation of putting the cream on, getting the injections and all of that kind of thing with not too much difficulty at all really. The difficult thing is I think when they wake up from the operation and they're in a very strange environment. She's obviously got the cast on and she's very restricted, and this is quite distressing, but again you have to reassure, you have to be very very calm yourself as well, and I think that really helps the situation then. The one thing we had to make sure about this time with Sophie, because she was a lot older, that we had to be careful as well, because lifting an older child in a cast as well is quite difficult, and you have to be very careful that you keep your back take good care of your back, because if you don't, then you're not going to be able to last for the weeks ahead. So before she went in for the operation, we contacted an occupational therapist who came round, looked at our home and decided what was needed. We had a hospital bed which you could lift up and down automatically, so that helped in terms of lifting. We had a hoist, which was, I must admit, we did use it a couple of times when we really did, when I was on my own, for example, but when my husband was there, we cheated and we lifted her. Because it can be quite long and time-consuming process with the hoist, but it is good to have a hoist, particularly if you're on your own and you're having to lift. The other thing we had was a chair that we could wheel her around on, much bigger than a hip spica chair, and it was was perfectly adequate to put her in it and to be able to wheel her. We also had a hip spiker buggy, which was very good as well. So we had a lot of equipment that we put in place beforehand that helped us in the care of Sophie and also for getting her around. We couldn't get her in a car, so that wasn't a possibility for us. But very luckily, we were able to get transport to school, and they were able to secure the wheelchair into transport to get her to school during the day. So we were very lucky that we were able to do that as well. Yes, you do have to do all of this before she goes into hospital, because once she comes out in the Spica, if you've not got anything, it's very difficult because it can take weeks. I would say it took a good 4 weeks for us to get all the equipment. The hospital bed was particularly useful to us, and we were able to put it downstairs, and we converted our dining room into Sophie's new bedroom. Yeah. So the other thing we did was prepare for rehabilitation after the cast, and this is something we had to research before the operation, because we had to be sure that she would get physiotherapy after the cast was removed. And this is specific maybe to Sophie because she has very low muscle tone, but a lot of children with special needs have a very similar situation. When they come out the cast, the muscles are totally wasted away, and you really need to work hard to get those muscles going. And with a typical child, that may be done within a matter of days or weeks. With Sophie, it takes many months. So we organised for physio to be done after the cast was removed. And we actually did get some private physio as well to supplement NHS physio, which is very sporadic in some cases. And as she does have a physio at school as well, and she was able to do the physio during the cast, while she was wearing the cast as well, so that helped. Yeah.